When is scoliosis surgery needed? What a great question, because obviously in certain situations it is needed. I believe in the surgery. I thank God for the surgeon. But I can tell you every year we're taking care of hundreds of cases, and maybe I'm sending 5 to 7 kids to the surgeon. But when I need them, oh my God, I am so happy to know them. And this, I feel, is one of our roles here, is to refer the patients on to the correct surgeon. We have a list of surgeons that we use, and these are the top people in the world. We're here 20 miles outside of New York City, and we have access to some of the greatest surgeons in the world. Thank God I have them here, and on the other side, thank God, I don't need them very often. There is a tremendous amount of research done on non-surgical treatment, and it also tells us when surgery is indicated. So when is surgery needed? If we have a very large curve, say over 60 or 70 degrees, if we have a child who's starting to have compromise with their lung function. Now, we have research on this. Research tells us that lung function doesn't get compromised until the curve is over 70 degrees. One research study said over 100 degrees before there's any significant lung dysfunction. So it's rare, but yes, it does happen. Or in specifically in adult cases, we have a surgical need if we have loss of control of the bowel or bladder. We have intractable pain. In other words, the person's consciousness is consumed by pain. They can't think of anything else. They need to have a surgery. Or they have withering of one leg. For example, one leg becomes thin, the other leg is normal in size. These are surgical cases. They need to have the surgery. But the truth is that the very large majority of situations, surgery is not needed. Surgery is chosen. Who am I to say to a family, yes, you should, or no, you shouldn't? I feel most people decide not to have the surgery out of common sense. Who wants to have a major spine surgery if they can possibly avoid it? But if it's necessary, you will never hear me talking down the surgery. I'm never telling people how terrible it is. Why? Because I don't want that child, that's 5 to 7 kids a year that I have to send to the surgeon to come back to me and say, oh, before you were telling me how terrible it is, and now you're telling me I should go? No, I never go negative on the surgery. I'm very pro-surgery. But I'm telling you, it's the very rare person who needs to have the surgery. Thanks for watching. I hope you found all this information helpful. Please subscribe if you'd like to have more information about scoliosis, and don't forget to hit the bell. That'll alert you whenever we publish new information. And if you've got any questions, write them in the comments field, and I'm going to make sure to address them in a future video. Thanks for watching.